Hi, my name is Angela. I'm here to talk about the SP Dynamis ND YAG leg veins. We do it in VersaPulse, which is millisecond. The ND YAG can do red veins and blue veins. It can do facial veins and body veins, hemangiomas, spider veins, and port wine stains. We have multiple spot sizes. We have 2, 4, 6, and 9 millimeter spot size. Okay, so we're going to be doing leg veins. You do leg veins with the ND YAG component of the SP Dynamis. You hit the ND YAG screen. Your options for what you can treat in this screen are available. We're going to press the button for leg veins. The little green house to the left here, if you press that twice, you will get red veins or blue veins, and then you can get small veins and as you go up in size. So if you hit red veins and small, it gives you settings. And this is what we're treating. 130 joules, 15 milliseconds. The milliseconds decides how thick the vein is. The smaller the vein, you use 10 milliseconds. As the vein gets larger, 15 up to 25 milliseconds. 6 millimeter spot and 1 hertz because you only want 1 pulse per second. With leg veins, you must use a Zimmer cooler at all times. There's a white attachment that comes with the R33. You connect this to the end of the Zimmer. The hand pieces, the 6 and the 9 millimeter spot. It's important to always have this bullet up to read that this is the 6 millimeter. And then the bullet goes into the machine like this, and the 6 millimeter spot's in there. So with leg veins, it's very important that you use the Zimmer before, during, and after. You have to use a little bit of gel to cool the skin. You want about as much gel as a thin ice donut, not a frosted tip donut. So just a very small amount of gel. The handpiece always has to be perpendicular to the skin. You hit the on-off button. It's asking you to check. This is the R33 with the 6 millimeter spot size. Say OK, and you only do 1 pulse at a time. Pulse. And then you check the area. You're looking for a refill or a change in the vessel. Never repulse the area, just move up the size of the spot. You feel that?
I feel it.
Are you okay? I always check with the client to see if they should feel a little snap, a little bit of pain. And you're looking for the vessel to change color. So it started off with blue, and now it's slightly red, and you're looking for a refill. So if it doesn't refill, that means the blood is coagulated inside the vessel, and you can just move up the vein. Sometimes at the end it looks like a cat has scratched them, like there's a little bit of redness. And always work from the bottom up towards the heart. If we want to do these little vessels around it, you'd have to decrease the spot size because the spot size is smaller to match a smaller vessel. So we go to the machine and we're going to decrease the spot size to about 10. Some of the small ones might disappear. The client feels a little bit of heat in the vessel and can be uncomfortable. But always pressing, looking for refill, and looking that you don't rupture the vessel. You just coagulate with the heat inside the vessel. Well, this is an excellent treatment. The large blue vessel has changed color. The small vessels around it, some have disappeared and some have just gotten a little bit darker, which means the laser is heating up. Never ever do a second pulse in the same area. The risk of ulcerating the skin becomes greater.